If you want to live a long time, then this video is going to be essential for you from a food perspective anyway. Because if there is one meal, one starter, one main, one dessert, and a drink that if eaten regularly would protect your heart and lower your risk of death more than any other food, it would be this. It's delicious, it's fairly easy to make, it's absolutely full of roughage and goodness, and honestly, I eat this sort of stuff every single week. Because this meal, all three courses of it targets inflammation, the oxidation of cholesterol, it targets your blood pressure, your blood sugar, and the health of the lining of your blood vessels, all of it in one sitting. And by the end of this video, you will understand why. If you're new here, then hello, I'm Dr. Alex. I've been working in the NHS as an emergency medicine doctor for a decade. And now I'm sharing everything I know with you to help you prevent the stuff that I see every single day. And if you learned something from this video today, then please support what I'm doing by liking the video, subscribing to the channel, and I'll just keep making these videos for you. But let me just give you some context for where this video actually came from. So a couple of weeks ago, one of my patients came in with chest pain, something that we see literally all the time. And the way that she described those pains, with the pain coming on when she walked and feeling like a pressure in the chest and in the jaw, and then sort of going away when she stopped walking, to me and to any doctor watching this, that sounds like what we call stable angina. Now, her ECG was normal, her blood tests were normal, everything else looked fine on paper. So it was appropriate to send her home with some medication, some lifestyle advice, and some urgent tests with cardiology. But clearly from her lifestyle and the way that she was describing these symptoms, this had clearly been going on for a very long time. And so after we'd sorted out her immediate management and got the ball rolling with the right investigations, she asked me, what's the healthiest meal you could actually recommend to me right now? What is the best thing that I can go out and eat? And I thought that this was an absolutely great question. Most people in the A&E just want the medication and to go home. So, we love it when people ask about these sorts of things. And honestly, this is what I told her, because as it happened, this was almost exactly what I'd had for dinner just a few nights before. The thing is, food isn't just a complement to treating heart disease. For a lot of people, in the early stages at least, it actually is the treatment, and it's the treatment for lots of different conditions. The mechanisms behind different foods are real. The evidence is really strong. As I always say on this channel, the difference I can make to somebody's symptoms with diet and exercise is far bigger than most of the medications that I can offer you without any of the side effects as well. Now, obviously, it goes without saying that if you are getting angina, then medication is essential at this stage. If your coronary arteries are so diseased that just walking gives you cardiac pain, then I'm not taking any risks here. But for most things in the early stages, lifestyle advice always wins. So anyway, what I want to do today is walk you through this exact meal, step by step, what's in each dish, how to actually make it, and then this is the bit that I really want you to stay for, exactly why each ingredient is on this plate, down to what it's actually doing inside your arteries. And obviously, feel free to skip over the actual method of making it if you want and use the timestamps below. And look, obviously I am in the studio here today. I am not in the kitchen cooking this in front of you, but honestly, I wish I was. Something that is a big goal of mine, something I'm really looking forward to, is actually doing a proper cooking series on this channel. We are currently building our house, and at the moment we live in a caravan, literally in a field. So I can't do that at the moment. So for now, just bear with me, and I'm really hoping this video is still useful for you. I'm going to describe every step really clearly so that you can do this in your own kitchen tonight if you want to. And what I told my patient is to eat as much of this as you like until you feel full. Don't be worrying about calories or portion sizes, especially if you're trying to move away from a diet that's been heavy in ultra-processed food. Just focus on getting these foods into you because, we need to get away from this mindset that less is always better. With food like this, you're not just eating, you are essentially taking medicine. These ingredients have real, measurable biological effects. So eat until you're full, get the full dose, and let the food do what the evidence shows it can do, and you'll probably find that your cravings for sweet things go down as a result. Remember that it's the quality of the food on the plate that is important right now, not the calories. So the starter is a lentil, rocket or arugula, and walnut salad with an extra virgin olive oil and tahini dressing. Now the lentils are one of the best sources of soluble fibre on the planet, and they have a direct, well-evidenced mechanism for lowering LDL cholesterol. So forget these expensive fibre supplements that other people are trying to sell you. You can get everything you need from proper whole foods that have endless other benefits. Now, the walnuts bring plant-based omega-3 fatty acids to help stabilise the plaques that might already be forming in your coronary arteries. The extra virgin olive oil in the dressing protects LDL from becoming oxidised, which is really the dangerous part, and I'll explain that in a bit more detail in a minute. And the rocket or arugula adds dietary nitrates that support the health of your blood vessel lining. So this isn't just a salad for the sake of having a salad. Every single component is doing a job. Right then, so how do you actually make it? And feel free to skip over this if you want to. So you want to start by rinsing around 200 grams of green or poi lentils and putting them in a saucepan covered with cold water. Bring them up to the boil, then turn it down to a simmer for around 20 or 25 minutes until they're tender but still holding their shape. You don't want them to be mushy, you want them to still have a bit of bite to them. Drain them off and then set them aside to cool down. Now, while the lentils are cooking, you need to make the dressing. So add 3 tablespoons of extra virgin olive oil. And I always get mine from citizensofsoil.com, where they actually show you the polyphenol count on the bottle. And I'll come back to why it has to be extra virgin olive oil in a second. Add a tablespoon of tahini, the juice of 1 lemon, 1 small crushed garlic clove, a pinch of salt, and a little bit of water just to sort of loosen it up a bit. Whisk all of that together until it's smooth, and then sort of roughly chop a large handful of walnuts. And then when the lentils are done, toss them while they're still a bit warm with the dressing, pile them on a bed of rocket, scatter the walnuts over the top, and that is pretty much it. It's as simple as that. Now let's talk about what's actually going on. So the lentils, one of the best sources of soluble fibre that you can eat. And this kind of fibre, soluble fibre, has a very specific, well-established mechanism for lowering LDL cholesterol, which is the type of cholesterol most strongly linked to the buildup of plaque in your arteries. And here's how it works. So your liver produces something called bile. Everybody's heard of bile, which it uses to digest fats. Now, bile is actually made from cholesterol. Now, normally, after bile has done its job in your gut, your body reabsorbs it and recycles it back to the liver. But soluble fibre, the kind in lentils and oats and legumes, it binds to that bile in your gut and it carries it out of your body before it can be reabsorbed. So when the liver is running low on bile, it has to make more of it. And to make more bile, it has to pull cholesterol out of your bloodstream. So your LDL goes down as a result, not because you're eating less cholesterol, but because your body is actively using more of it up. Multiple meta-analyses, and these are the big studies that use data from lots of individual trials, have consistently shown that regular legume consumption significantly reduces your LDL cholesterol. This is genuinely how you lower your cholesterol without a statin. Because there's a really common misconception that the problem with cholesterol is just how much of it you have. And that's not really the whole picture. The real danger, the thing that actually triggers a heart attack, is when LDL cholesterol becomes oxidized. And to understand why, it helps to know a little bit about what LDL cholesterol actually is. So LDL particles carry a protein on their surface called apolipoprotein B, ApoB for short. And it's these ApoB carrying particles that are the real culprit in atherosclerosis, because they are the ones small enough to penetrate the wall of your artery. Once they are in there, if they get oxidized, and think of it a bit like metal rusting, they become unstable and inflammatory. Your immune system sees them as an intruder and then attacks them. And that immune response causes inflammation inside the artery wall. And then over time, that inflamed, oxidized mess is what builds into the plaques that can rupture and cause a heart attack. So the goal isn't just to lower LDL cholesterol as a number, it is to lower the number of ApoB particles circulating around and to protect the ones that are already there from becoming oxidized. Now, extra virgin olive oil, and it genuinely has to be extra virgin, not just normal olive oil, not a blend, because the processing here actually destroys what makes it valuable. Extra virgin olive oil is actually rich in something called polyphenols. These are these natural compounds that directly reduce LDL oxidation. They also stimulate the production of nitric oxide in the lining of your blood vessels, which helps to keep those vessels relaxed and flexible. And they also reduce systemic inflammation throughout your body. Now, the PREDIMED trial, which I've covered in lots of different videos, showed that a Mediterranean diet supplemented with extra virgin olive oil reduced major cardiovascular events by around 30%. 30%, that is massive. And that effect is driven substantially by exactly this mechanism. And then we've got the walnuts here. So walnuts are one of the only plant foods that contain a big amount of alpha-linoleic acid, which is a plant-based omega-3 fatty acid. And omega-3s actually improve your lipid profile. They reduce your inflammation levels. And this is the part that I find most interesting clinically. They appear to help stabilise atherosclerotic plaques. And here's something that I think is really important to understand about plaque. Not all plaque is equally dangerous. Stable plaque, plaque that has a thick fibrous cap over it, can actually sit in an artery for years without causing a heart attack. It is the unstable plaque, the inflamed, thin-capped, fragile plaques that rupture and cause a heart attack. Because when they rupture, they trigger a clot, and that clot is the heart attack. Omega-3 fatty acids, through their anti-inflammatory effects, are associated with more stable plaque. Inflamed plaque ruptures and causes a heart attack. Stable plaque doesn't. And that distinction really is everything. So you've made the starter, you've made the salad, now let's move on to the main course. Right then, so the main course, and look, it might not be to everybody's taste, but I really like it. It is baked salmon with steamed broccoli and spinach served on quinoa and sliced avocado. And again, this isn't just a random collection of healthy sounding ingredients sort of thrown together. The salmon is one of the most powerful anti-inflammatory foods that you can eat, and it has direct evidence behind it for cardiovascular protection. The greens contain these special compounds that your body converts into nitric oxide, which keeps your blood vessels flexible and your blood pressure down. The quinoa helps to keep your blood sugar stable throughout the evening, and the avocado adds the kind of healthy fat that protects your arteries rather than damaging them. Together, these four things address the parts of heart disease that the starter didn't already cover, which I think is quite remarkable for one plate of food. So preheat the oven to around 180 degrees Celsius. Take a salmon fillet and, leaving the skin on is absolutely fine. Put it onto a lined bacon tray, drizzle it with some extra virgin olive oil, season it with some salt and some pepper and a squeeze of lemon. Put it into the oven for around 15 or 20 minutes, depending on how thick your fillet is. The back of the packet will tell you how long to cook it for. And you want it sort of just cooked through, still slightly soft in the center. While the salmon is in the oven, you want to get around 80 grams of quinoa and cook it in a saucepan with twice the volume of water, so around 160 ml. Bring it to the boil, reduce it to a simmer, cover it up, and then cook it for 12 or 15 minutes until the water's absorbed and you can see sort of the little white rings appearing around each grain. Take it off the heat and then leave it covered for 5 minutes. Or just buy the pre-cooked stuff in the pouches that you can put in the microwave. These are really easy and these are absolutely fine for you. At the same time as that, you want to steam the broccoli and the spinach as well. So cut the broccoli into florets or just buy the tender stem stuff, put them into a steamer or just a colander over a pan of boiling water with the lid on and cook them for 5 or 6 minutes. Add the spinach right at the last minute. It literally just needs a few seconds. Season it lightly with some salt, slice half an avocado, plate it all up like it is in the photo that I'll put on the screen here, Use the quinoa as the base, the salmon on top, the greens alongside it, and the avocado fanned out next to it. Now that is a really, really healthy main course. So let's talk about what all of this is actually doing. So salmon is one of the richest sources of what we call EPA and DHA, the two long-chain omega-3 fatty acids with the strongest cardiovascular evidence behind them. And these are different from the plant-based omega-3s in the walnuts. They're more potent and more directly active in the body. Now, EPA and DHA, they lower your triglycerides. These are the fats in the blood that independently contribute to heart disease risk. They reduce systemic inflammation by directly modulating the inflammatory pathways that drive plaque development. They improve the function of the lining of your blood vessels. And as I mentioned with the walnuts, they contribute to the stability of the existing plaques. Really large cardiovascular trials have actually shown that in people with established heart disease, high-dose omega-3 supplementation reduces cardiovascular events, but getting it from food, from 2 to 3 portions of oily fish a week, if you can, is where the evidence is most consistent and most accessible. Now, the broccoli and the spinach, both of these are really high in dietary nitrates. And these nitrates, once you eat them, they get converted first by the bacteria in your mouth and then by your body into nitric oxide. And nitric oxide is one of the most important molecules in cardiovascular health. It's produced by the cells lining your blood vessels, the endothelium. And its job is to essentially tell the vessel wall to relax and widen. When your endothelium is producing good amounts of nitric oxide, your blood vessels are flexible. Blood flows through really easily, and your blood pressure is lower. When endothelial function is impaired, which is actually one of the earliest signs of cardiovascular disease, your blood vessels become stiff. Your blood pressure then rises and the risk of plaque development goes up significantly. Think of the endothelium as the gatekeeper of your heart health. If it's healthy, everything else downstream tends to be healthier. If it's damaged and inflamed, then the whole system starts to fall apart. And dietary nitrates from green leafy veg like kale and spinach and broccoli, and also things like asparagus as well, these directly support that function. This is why blood pressure guidelines increasingly emphasize eating more veg, not just cutting salts. And the quinoa has what's called a very low glycemic load, which basically means it releases glucose into the bloodstream really slowly and steadily, rather than as a sharp spike. And this matters enormously in the context of heart disease because of the relationship between blood sugar control and arterial damage. When your blood sugar spikes repeatedly after meals from refined sugary carbs like pasta, white pasta and white rice and white bread, and basically anything ultra processed, your insulin level spikes with it as well. And if this keeps happening over time, your cells start to become resistant to insulin. They stop responding to it properly. Your body then produces more and more insulin to compensate. And that state, insulin resistance, is directly damaging to your arteries. High insulin levels drive oxidative stress, it promotes inflammation, and it accelerates the very process that builds plaque. Quinoa, combined with all of the fibre from the lentils and the greens, keeps the blood sugar response from this meal really low and stable. And the avocado adds what we call monounsaturated fat, similar to olive oil, which further blunts that blood sugar response and adds another layer of anti-inflammatory effects. And the part you've all been waiting for, my favourite part, obviously because I've got such a sweet tooth, is the dessert. And this is really the simplest one to put together. It is full-fat Greek yogurt. Try and get the 10% stuff if you can, mixed with berries and pistachios. And I know when some people hear full-fat, they immediately think that that's wrong, but stay with me on this. The berries contain compounds that directly improve the health of your blood vessel lining. The yogurt, and this is the one that surprises most people, supports the bacteria in your gut that regulates inflammation and cholesterol. And the pistachios add another layer of heart protective fats and fibre. This is genuinely a dessert that is doing something. This is good for you. Now, to make it, you need 2 to 3 generous tablespoons of full-fat Greek yogurt in a bowl. a large handful of mixed berries on top. So that can be blueberries or raspberries or strawberries or blackberries, which are my favourites, whatever you've got in the fridge or whatever's in season. And yes, frozen berries are absolutely fine. And then on top, just add a small handful of pistachios, either whole or just roughly chopped, and that is it. Honestly, that is just 2 minutes worth of work. So the berries, these are really rich in compounds called anthocyanins. These are the pigments that give them their really deep colour. And generally, the darker the berry, the more sort of protective it is for you. And they are among the most potent natural compounds that we know of for improving endothelial function and reducing oxidative stress. Studies have actually shown that regular berry consumption measurably improves the ability of your blood vessels to dilate, to widen on demand, which is a direct marker of your endothelial health. In people with cardiovascular risk factors, that effect is really significant. Now, the Greek yogurt, so a lot of Greek yogurts are fermented, which is a good thing. It means it contains live bacteria and probiotics that support a diverse and really healthy gut microbiome. And the connection between gut microbiome health and cardiovascular disease is one of the most rapidly developing areas of research right now. And I've done a couple of videos on the gut microbiome in the past. We know that the bacteria in your gut produce compounds that directly enter your bloodstream and influence inflammation and cholesterol metabolism and your blood pressure regulation. A diverse and healthy gut microbiome is associated with lower cardiovascular risk. A disrupted gut microbiome driven by processed food or low fiber or just a poor diet generally, or a lot of antibiotics in the past, and that is a different video for another time. This is associated with higher heart attack risk. And proper Greek yogurt eaten regularly is one of the easiest ways to actually support that diversity. And then we've got the nuts. So pistachios, alongside other nuts and seeds and legumes generally, these are really rich in a compound called phytosterols. And phytosterols are really interesting because they're structurally almost identical to cholesterol. Chemically, they look so similar that when you eat them, they compete directly with cholesterol for absorption in your intestines. And because phytosterols win that competition, less cholesterol gets absorbed. The liver then has to compensate by pulling more LDL particles, those ApoB carrying particles I mentioned earlier, out of the bloodstream to maintain its cholesterol balance. So you end up with fewer of them circulating around your blood, which is clearly a good thing. Meta-analyses, again, these big studies have shown that phytosterols can reduce LDL cholesterol by around 14 milligrams per deciliter on average. And that is a really meaningful number. And you're getting that simply just from a handful of pistachios on top of a bowl of yogurt. Finishing the meal the same way it started, with ingredients that are genuinely earning their place on the plate. And then we've got the drink, and this drink might not be to everybody's taste, but just give it a try and see how it tastes. The drink here is kefir, just plain unsweetened kefir. Now, kefir is a fermented milk drink made by fermenting milk with a combination of bacteria and yeast. Sounds great, doesn't it? It tastes quite good, and it's one of the most potent sources of probiotics you can actually consume, more so than any yogurt. Now, the fermentation process produces a much wider and more diverse range of live bacterial strains, and diversity really is the thing that matters the most when it comes to your gut microbiome health. Now, some people find the taste a bit sharp or a bit sour at first. Well, that is the fermentation, but you get used to it really quickly. And the evidence behind this is really compelling. The bacteria in kefir survive the journey through your gut better than most probiotic supplements. They colonize more effectively, and the effects on your microbiome are really measurable. The effect is really significant. And again, a healthier gut microbiome means better regulation of your inflammation levels, better cholesterol metabolism, and lower heart attack risk. So the kefir isn't just a drink to wash the meal down, it is medicine. It is extending the same biological work that the yogurt and the rest of the meal started. You're essentially doubling down on the gut microbiome support at the end of the meal. And if you don't like kefir, then that's fine. Kombucha is another reasonable alternative. It's also fermented, it tastes really good, it also contains live cultures, so the evidence base is a bit less developed. But just plain kefir, if you can get used to it, is where I'd start. So look, you don't reverse heart disease with one meal. I want to be really clear about that. That is obvious. If you have established heart disease, or if you have heart symptoms like chest pain when you walk, or pain in your arm, or your neck, or a pressure in your chest at any time, then you need medical management alongside all of this. You need to see a doctor first before doing any of this stuff. I'm not suggesting at all that food replaces any of that, but what you do with every single meal is send a signal, a biological signal to your arteries, to your immune system, to your endothelium. And the signal from these 3 plates, if eaten regularly and consistently as part of a broader pattern, is repair rather than damage, which is what most ultra-processed foods do. Stability rather than inflammation. And the research on this is absolutely real. None of this is waffle. There is evidence behind all of this stuff that I've mentioned. Lifestyle interventions, including dietary change, has shown actual regression of coronary plaque in clinical trials. Now, there is no magic ingredient in anything I described tonight. There is no single superfood in any of this. What this meal does is target every major driver of atherosclerosis, the disease process that causes heart attacks, all at the same time. Lower LDL burden through fiber, reduced LDL oxidation through the polyphenols, stabilised plaque because of the omega-3s, improved blood vessel function through the nitrates, controlled blood sugar through the low glycemic carbohydrates like quinoa and the healthy fats, reduced systemic inflammation through almost every ingredient on these plates. Most medications target one pathway. This meal targets 6 simultaneously. So if I had heart disease, I wouldn't start with a supplement. Obviously, it goes without saying. I wouldn't start with a detox. I would start here with a plate that actually understands the disease, that has real powerful whole foods.